Meeting the requirements for the ever-changing mandates of chronic disease care and prevention is an ongoing challenge for every healthcare provider. Fortunately, EHR Integration Services has developed an add-on solution for Allscripts TouchWorks called Quality Information Systems, or QIS, that helps meet these challenges. Here are some of the benefits of QIS. Real-time access provides immediate feedback on patient quality performance measures. Minimize your risk of overlooking quality metrics that are outdated or not in compliance. Improve patient service by relying on QIS alerts to highlight and triage patient needs. Maintain compliance by using QIS to support meaningful use attestation. Here's an overview of how QIS works. You access QIS within TouchWorks by clicking on the QIS tab. The QIS traffic signal indicates quality measures needing attention based on the patient's diagnosis list and the QIS measure configuration. A red traffic signal indicates that several quality measures need attention. Yellow indicates that a handful of quality measures need attention. And a green traffic signal indicates that all the measures set up in QIS are up to date. QIS utilizes the patient's TouchWorks problem list to determine the list of conditions. For example, Doug has a yellow traffic signal indicating there are measures that need attention. On his problem list, he has diabetes, obesity, and is a current smoker. To determine the exact measures that he is not meeting, click on the QIS tab within the TouchWorks menu structure to view the QIS dashboard. Based on the traffic light concept, a user can quickly see that Doug's A1C and aspirin regimen are red, indicating that they are either not documented or expired. In contrast, the diabetic supplies are green, indicating they are being met. Individual measures can also be yellow, indicating that the measure is close to being overdue, but at this date is still being met. QIS allows users to manually exclude patients from measures for which they qualify. Doug has had a foot amputation, making him ineligible for a diabetic foot exam. Once a measure is documented as excluded, the line will be grayed out until the exclusion no longer applies. A key is provided at the bottom of the QIS dashboard to help the user keep track of this color scheme. QIS can be set up to track measures based on the user, showing only measure groups assigned to the user logged into QIS. For example, this signed-in user is assigned responsibility for smoking cessation, diabetes, and adult health, as shown by required and preferred, while obesity and high cholesterol are not the responsibility of this user and appear blank. QIS also tracks preventative care measures. These are set up by age and track several items, such as mammograms, flu vaccines, documentation of smoking status, and much more. For immunizations, QIS provides the CDC immunization schedule, which you can edit, making the "What is due next for well-child checkup" question easy. QIS also utilizes Unity to allow efficient measure updates within a few clicks, directly populating TouchWorks with discrete data elements. For example, by clicking the Edit button for flu shot, you can choose the appropriate immunization. Select the date and click Insert. This will update the QIS dashboard and TouchWorks EHR. You can expand or collapse measure groups for easy viewing. Clicking Status View aligns all measures based on expiration date. Measure Report or Near Due Report are options that present true reports that can be printed and given to the patient. QIS also offers accompanying reports to take chronic disease management to another level. These reports are available from the Reporting tab for all providers within the system. Here's an example of the Analytical Measure Report. After entering a few filters, quality managers can get a quick summary of how a measure is being managed. Based on the previous filters, the gray line in the following report provides details on organizational, and individual provider quality measure performance. Clicking on a number in the Total Patients column shows a detailed subreport. If more detailed reports are needed, the Provider Measure Group is a great tool for review or printing. The Provider Measure Group with demographics contains the same details, but in a linear fashion. This is ideal for exporting to a spreadsheet and filtering. For security, access to reporting can be limited, allowing only authorized providers to run patient reports. QIS is a powerful tool, but also exceptionally easy to configure. There is no need to understand any computer code or report writing capabilities. During implementation, a QIS professional will provide training on how to set up the measures and measure group, putting the power of QIS in the hands of your organization. QIS allows healthcare staff to accomplish disease management and preventative care for each patient with little research or staff education. As shown, QIS is a key partner for healthcare teams to ensure they seamlessly track and meet today's requirements.